Welcome to the COVID-19 update for today, Thursday, March 24, 2022. Today we take a look at the COVID-19 disease and tuberculosis as the world observes World TB Day 2022.
Today has been set aside to highlight the challenges that we have with reducing the burden of TB diseases. And the day is usually put forward by the international body to bring that focus that TB is still a major problem. And in Guyana, we have used the occasion to highlight some of the things that we have been doing here in Guyana to reduce the burden of TB. We currently have, I would say, about 500 persons with active TB. And as you know, it is one of those diseases that you have to be on treatment for a relatively long period of time. In some cases, between 4 to 9 months, you have to be on treatment. And if your treatment is interrupted for whatever reason, then that can pose a challenge because sometimes the person can develop multiple drug resistance TB, which is even more difficult to treat. In Guyana, as you know, with the surge of COVID, we would see persons who would have active TB also can get infected with COVID, and that can be a challenge in terms of how they are managed. But you would have realized that when we talk about COVID-19, we talk about persons who would have comorbidities. So comorbidities can be infectious diseases, or it can be non-infectious diseases, such as the chronic non-communicable diseases. And we have seen patients who came in with COVID-19 having to be hospitalized. So right now what we are seeing with COVID-19 is more an upper respiratory tract kind of infection, which means that some people would have nasal congestion, some might have a slight fever, scratchy throat, that sort of thing. With TB can be regarded as a chronic illness. You will have a low-grade fever. Some people would experience a loss of weight. Some persons would have persistent coughing. When they cough, the coal that comes out can have blood, so you can have coughing with blood. They lose a lot of weight. So the signs are totally different. A person who has active TB also develop COVID-19, we have to see what stage they're at. So, for example, if they have a mild form of COVID-19, then we'll just treat symptomatically. They'll continue to use their meds for TB. If it's a more moderate to severe form, that would require hospitalization, and the doctors there would take the appropriate steps in how to treat, depending on what symptoms the patient is manifesting. We have a category of workers called DOTS workers. That's the directly observed therapy workers. So what these persons would do is to go home to the patient and be able to observe them taking their medication. And in that way, we get better compliance, and we prevent defaulting. And we also prevent people from getting multiple drug resistance TB, because if they're more compliant, the chances are, we'll be able to treat them and get rid of the TB from their system. So that's what we have been doing. We have been doing DOTS, but When we had big spikes, it was very challenging. And so one of the new methods that we did was to do what is called video dots. Using a cell phone, the patient would have a cell phone and show us that they're actually drinking their meds. And we do that in real time. Now that the numbers have, the cases of COVID has dropped significantly, we are able to go back to routine monitoring, where the dots workers would go out and monitor people. We have also been doing some work to identify cases of multiple drug resistance TB. So that work is ongoing. We had made some projections of how many cases we estimate we'll have in Guyana. Unfortunately, we haven't seen the cases that we have projected. That's a good thing. So we have overestimated. But nevertheless, we made sure that we have the types of medication to treat these patients. The vaccination numbers, we are right now for adults, 437,630 first doses. That's about 85.3% of that age cohort, that's 18 and above. For second dose, we are 335,691 doses. That's about 65.4% of the 18 and above population. In terms of adolescents, we are 34,234 doses administered for the persons 12 to 17. That's 46.2% of that age cohort. And in terms of second doses, we are at 24,896 doses administered. So that's approximately 34.1% of that age cohort. And booster doses have gone up slightly. We are now at 57,071 doses administered.
You have been watching the Daily COVID-19 Update. I'm Natasha Smith-Thomas. Goodbye.